When you go to the hospital or your doctor's office, you trust the staff will clearly document the care you received.
But a local woman told me that didn't happen for her, and her records were missing crucial information. So I started investigating how often the state is finding these problems and what's being done to make sure your doctor's notes are detailed.
My hand shakes, and it is a lot different.
Deborah Pittman says brushing her hair is difficult because of continuous pain in her left hand. She blames a 2016 trip to Caramont Regional Medical Center in Gastonia, where she received a CT scan because of respiratory problems.
Since that day, my life has changed drastically. It affects me emotionally, physically.
Pittman claims staff inappropriately administered contrast fluid through an IV in her hand.
It was burning, excruciating burning.
Pittman says this picture she took that day shows where staff tried to move the IV, attempting a second stick in her arm before a third successful IV near her elbow. When pain in her hand persisted, Pittman requested her records, trying to get treatment covered.
You say information is missing from your medical records.
Absolutely, because I have a picture to prove it.
Her nearly 400 pages of records mention only one IV.
Look, this happened. Why is it not there? Why is it not there?
Caramont Regional medical officials told me they investigate all patient complaints and grievances, but they cited patient confidentiality and wouldn't comment on Pittman's claims. Caramont said, quote, "We have many procedures and protocols in place to ensure and support that safety, including the active monitoring and investigation of all safety-related activities and concerns." I learned the issue of inadequate medical records has caught the attention of the North Carolina Medical Board. Officials tell me in cases where they take disciplinary action against doctors, they find record keeping is a problem 25% of the time. Dr. Karen Burke-Haynes, the board's chief medical officer, says the board closely examines what doctors put in patient charts.
If it lacks detail, if it's inaccurate information, absolutely, it can be harmful.
The board updated its medical records policy this past summer, alerting doctors of the expectations. One concern is that some doctors may rely too much on electronic software.
You can basically autofill.
Dr. Babak Mokhari showed me how the convenience of electronic records
So this is just making it very, very quick and easy to then be able to document.
could create problems if doctors don't add specific details.
Otherwise, every visit's going to look the same. And it's going to seem like the interactions with the patients are all sort of generic.
Pittman says she never received an explanation for the missing information, but she hopes her story is a lesson to other patients.
You need to pay attention to this stuff and always question, say, hey, did you put that in my chart? The medical board has advice. Ask for a summary of care after every appointment. Use the online patient portals to access your records and your test results. And if you disagree with information, you have the right to ask that an amendment with your point of view be included in your file. You can read Caramont Health's full statement about Pittman's claims on WSOC-TV.com. Just look for my report on the homepage.